Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Union Minister of State Kapil Moreshwar Patil emphasizes on the need for Nagaland to implement Svamitva Scheme. Nagaland Chief Secretary J. Alam stresses on functioning of offices with full capacity. Nagaland Health Minister S. Phom inaugurates oxygen generating plant at Longleng District Hospital. And NITI Aayog releases comprehensive report titled Health Insurance for India's Missing Middle. As India achieved the milestone of vaccinating 100 crore people against COVID-19, All India Radio salutes all the people, doctors, nurses and others who made this possible. Even though the country has achieved this feat, we caution our listeners that the battle against COVID is not yet over. We appeal to our listeners who are yet to fully get vaccinated to get vaccinated at the earliest and also help others to get vaccinated. During the festival season, please follow these 3 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075 and state helpline number 1800-345-0019. And now the news in detail. Union Minister of State for Panchayati Raj Kapil Moreshwar Patil has emphasized on the need for Nagaland to implement Svamitva Scheme and requested the state government to sign an MOU with the ministry to implement the scheme at the earliest. Addressing media persons at Kohima today, he said the scheme, which is a reformative step towards establishment of property in rural inhabited areas, will benefit the people of the state as it provides legal ownership cards to the property owners, reduce property-related disputes, and comprehensive village-level planning. He said a Svamitva scheme has garnered a good response from different parts of the states since its launch. The minister said if Nagaland implements the scheme, it will benefit the people at large. He said through the property cards, the people of the state can avail loans and other financial benefits. Patil said the central government is mainly focusing on the development of Nagaland. Citing that Nagaland has similar scenic beauty with Kashmir, the minister said Nagaland can become a tourist hotspot. He said if tourism grows, it will benefit the people economically and therefore more emphasis should be given to tourism sector. To this, the minister also said the central government is ready to assist the state. Patil also informed that under the 15th Finance Commission, the centre has allotted 125 crore rupees for the development of the state. Nagaland Chief Secretary J. Alam held a meeting with administrative heads of departments and heads of departments today. During the meeting, the Chief Secretary emphasized on the functioning of offices on full capacity with the COVID-19 situation normalizing in the state. He also addressed the issue of attendance and punctuality in all the government departments. Alam further urged all the departments to come up with a proper working system to check the attendance of the employees and ensure that proper work timings are maintained in all offices. Several issues related to delayed pension of retired government servants and the need to bring reforms in the system were discussed, besides the upcoming events on International Tourism Mart and the Hornbill Festival. Nagaland Health Minister S. Phom inaugurated the oxygen generating plant at District Hospital Longleng today. Pangnyu in a tweet said the plant is the first to be officially initiated under UNICEF. He said that we are fortunate to get access to oxygen generation plant in our doorstep in a strategy to combat COVID-19 and other adverse diseases. The health minister also called upon the people to get vaccinated and utilize the facilities with responsibilities. NITI Aayog today released a comprehensive report titled Health Insurance for India's Missing Middle, which brings out the gaps in the health insurance coverage across the Indian population and offers solutions to address the situation. The report was launched in the presence of NITI Aayog CEO Amitabh Kant and Additional Secretary Dr. Rakesh Sarwal. NITI Aayog member Dr. V. K. Paul in the foreword to the report highlighted the need for health insurance coverage for all and said significant challenges will need to be overcome to increase the penetration of health insurance. He further mentioned that the government and the private sector will need to come together in this endeavor. Dr. Paul said private sector ingenuity and efficiency is required to reach the missing middle and offer compelling products. He said the government has an important role to play in increasing consumer awareness and confidence, modifying regulation for standardized products and consumer protection, and potentially offering a platform to improve operational efficiency. NITI Aayog CEO Amitabh Kant said the report is an effort to reinvigorate the dialogue on increasing financial protection for health and a broader goal of universal health coverage. Kant said it outlines the current landscape, existing gaps, and articulates broad recommendations and pathways to increase health insurance coverage. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. Nagaland today reported 39 fresh COVID-19 cases, increasing the tally to 31,811. Dimapur reported 24 fresh cases, Mogokchung 9, Kohima 5, and Peren 1. Total recovery from the infection has gone up to 29,864, with a report of 20 more recoveries. No COVID death was reported today. Active caseload in the state is 222. Minister of State for Panchayati Raj, Kapil Moreshwar Patil, inaugurated a farmers' market at Tikal Motul village today in the presence of Minister for Rural Development, Mitsupu Jamir, and other officials. In a tweet, the minister said, "This market has given local farmers the right to sell their produce." He also interacted with the farmers. Earlier, Patil visited the Kohima War Cemetery and Kohima village. Home Ministry has extended the COVID-19 restrictions across the country till 30th November this year to prevent any further spread of the pandemic. Earlier, the ministry had asked states and union territories to focus on the five-fold strategy of test, track, treat, vaccination, and adherence to COVID-appropriate behavior. States have also been asked to maintain utmost vigil in respect of mass gathering events to avoid any possibility of a surge in COVID-19 cases. The government has approved the reappointment of Shakti Kanda Das as Governor of the Reserve Bank of India for a period of 3 years. The Appointments Committee of the Cabinet has approved the reappointment of Das. The reappointment will be effective from 10th December this year or until further orders. India has administered over 104 crores, 85 lakh doses of COVID vaccine so far under the nationwide vaccination drive. Union Health Ministry said more than 74 lakh 33,000 vaccine doses were administered in the last 24 hours. The ministry said 13,198 COVID patients recovered during the last 24 hours and the national recovery rate stands at 98.19%. Till now, more than 3 crore 36 lakh people have recovered from COVID-19. Currently, India's active caseload is around 1,61,000. And now to the news, here are main points again. Union Minister of State Kapil Moreshwar Patil emphasizes on the need for Nagaland to implement Svamitva Scheme. Nagaland Chief Secretary J. Alam stresses on functioning of offices with full capacity. Nagaland Health Minister S. Phom inaugurates oxygen generating plant at Longleng District Hospital. And NITI Aayog releases comprehensive report titled Health Insurance for India's Missing Middle. That is all we have in this evening news bulletin. Good night.